How's it going, guys? Cody back again, dropping yet another video. Guys, more prison news. Coronavirus, we're talking IPP prisoners, we're talking prisoners' health, we're talking for calls to reduce the prison population and potentially release a few thousand inmates due to the coronavirus or COVID-19 as it's been labelled in the media. This pandemic that's amongst us at the moment. Very worrying times for prisoners, very worrying time for their families. And I'm going to read the story, guys. I'm going to do my bit at the end. I'm going to put a link in the description below, as I always do. So if you want to browse at your own leisure, let's get into it, guys. COVID-19. UK prisoners with health issues face death sentences. Relatives say inmates on a controversial sentence may die in jail long after expected release. Maurice Stevens has been fighting to highlight the injustice of his son's imprisonment for more than a decade, but with the COVID-19 pandemic claiming its first death amongst the 83,000 prisoners in England and Wales, the pressure is on. An 84-year-old sex offender was confirmed as the first British inmate to die after contracting the coronavirus, with another 19 prisoners infected across 10 prisons. The death and rising number of cases behind bars has prompted calls for those with underlying health conditions to be at least temporarily released. Stephen's son, Danny Weatherson, 31, is in Northumberland prison. He was 17 when he was sentenced to a minimum term of 15 months for attempted robbery of a phone and a coat under a controversial imprisonment for the public protection sentences. Under IPPs, which were abolished in 2012 after a European court found them to be unlawful, offenders were given a minimum term but no release date. The sentences were used far more widely than intended, and in many cases for relatively low-level crimes. Aside from a brief period of release during which he was recalled to prison, Weatherson has been in jail for 14 years, and his father has been fighting to raise the profile of his son's plight ever since. 8 months ago, Weatherson was diagnosed with 2 blood clots on his lung and is receiving medication. Stevens says the emergence of the coronavirus, which affects the respiratory system, has deeply troubled both father and son. He's just terrified now, Stevens says, from his home near Gateshead. He was hoping for a July parole hearing, but it appears all that face-to-face hearings have been suspended. I spoke to him 5 days ago, and he was telling us all about his lungs and how they were feeling worse. Weatherson, who has a bipolar disorder, has attempted to kill himself twice in prison, and Stevens is worried that the panic over the virus could deeply upset his son. They need to hold emergency parole hearings because of the coronavirus. He's done a lot of time. What are they trying to achieve? They kept a lad in there for 14 years for trying to steal a phone. What does it achieve? Appeal. A charity law practice that specialises in fighting miscarriages of justice has called for the temporary or early release of the following groups of prisoners convicted of non-violent offences whose appeal applications have passed the single judge screening stage, prisoners on remand, those charged with non-violent offences, prisoners aged 70 or over with pre-existing serious health conditions, pregnant women, and all prisoners in Category D minimum security open prisons. Emily Bolton, the appeal legal director, said, "For the government to leave prisoners to die of COVID-19 behind bars when these deaths could be avoided is like leaving prisoners to drown in Orleans Parish Prison, where the waters rose after Hurricane Katrina. Britain is better than this, and time is running out to avoid minor offences becoming capital crimes, and life sentences from becoming death sentences." One of the appeals cases is that of Roger Khan, a man with Barrett esophagus, a condition which causes wheezing, shortness of breath, and chest tightness. Khan, 66, is in Oakwood Prison, where a case of COVID-19 has been confirmed. He was sentenced to 30 years for attempted murder and has been in prison for 9 years. His partner, Marie, who wrote to us, asked us to use a pseudonym, said, "I'm worried he's going to die in prison. That does worry me. He's really ill. I'd like him to be released on tag because of his health. He shouldn't be around the prison with the coronavirus. If he gets it, he will die. Marie said Khan had pleurisy, which affects the lungs, and was currently being isolated in Oakwood as he was classed as vulnerable. I'm quite disgusted with the prison and fearful for Roger. He should be released on medical grounds. Another appeal case is that of John Bear, one of the Freshwater Five. 5 men jailed for smuggling 255 kilograms of cocaine worth $53 million in a fishing boat. Bear, 51, who is also in Oakwood, was jailed for 24 years and has served 9. He's due to be released automatically in 3 years and is currently a Category D prisoner. After a long battle to appeal the conviction, Bear has granted a permission hearing before 3 judges and is awaiting for a date. His wife, Susan, who lives on the Isle of Wight, said, "He rang me to say that Oakwood has its first confirmed case. The guy is in healthcare in isolation. There's another 15 people in isolation on lockdown on the same wing." She said her husband was a red band prisoner, which means he's trusted prisoner. So he has access to all the different wings and does jobs like maintenance and supplies. He is literally on every wing. So that in that respect, that worries me because he could have come into contact. We know how long the germs can live on metal surfaces in prison. It's much more full of metal surfaces. She said the authorities should release all Category D prisoners or those who have a short time left to serve. John Whitwan, the managing director of G4S Custodial and Detention Services, which operates Oakwood Prison, said, we have one confirmed case of the coronavirus at HMP Oakwood. The health and safety of our staff and the people in our care is our top priority, and we have existing well-developed policies and procedures to place, manage outbreaks of infectious diseases. We are in regular discussion with the Public Health England and are following their guidance. The person concerned had already been self-isolating since last Tuesday in accordance with the national guidelines and will remain in isolation in regular consultation with our on-site healthcare professionals. His family have been contacted and will be kept up to date. A prison service spokesman said, the government's absolute priority is to protect the health, and we have robust and flexible plans in place to keep prisoners, staff and the wider public safe based on the latest advice from Public Health England. Sorry guys, I was struggling with that. My focus was all over, so I apologise about that. So there was 2 or 3 words there that are like medical terms that I've not heard. What first things I'm going to ask, right? What are your thoughts on what you've just heard? Right, like I've said, me personally, right, I agree with it. Like I said, there's so many people that are going to die because of this coronavirus in our prisons. 15% of the prison population have respiratory problems. 15%, right? You've got 1,700 that are over the age of 70, right? You've got a prisoner that was given a minimum term, right, of 15 months, right? So he can't be released before the 15-month mark. And then, like I said, he's got to jump through hoops, right? And he's been in prison for 14 years. Just unbelievable, guys. You know what I'm saying? Honest to God, it's just unbelievable. And we need to show compassion. Unfortunately, compassion is not a word that you see when it comes to prisons, right? People want to lock us up and they want to throw away the key, right? And in this situation, they don't care. I've seen nothing but nasty comments where it's come to discussions about releasing prisoners on short sentences. Those that, for me, all Cat C and Cat D prisoners should be cut loose. I would free IPP prisoners, right? I would release those prisoners that have got 12 months or less to serve. Get them out, get them gone. Takes the pressure off the system, makes it more manageable. Will save lives ultimately, right? But again, prisoners. If it was any other situation, you'd be like, yeah. But when it comes to prisoners, these people, right, are savages and they want us to die and they want to leave. They're like, yeah, well, good, they can't reoffend, yeah, and all this sort of stuff, right? But this is the thing, they're clueless, these people. They haven't got a clue. Most offenders, before they've ever been offenders, guys, they've first been victims. And people think, what do you mean? Just the criminals are bad people, they're bad apples, right? Most of these kids, not all of them, a lot of them, myself included, we've had bad childhoods, bad upbringings. Our parents might have been addicts. We might have grown up in care leavers, sexually abused, physically abused, emotionally abused, learning difficulties, just different underlying mental health issues that have been diagnosed, undiagnosed, ADHD, ADD, autism, Asperger's, right? Like I said, and you can't use these things as an excuse for your criminality, but they can be contributing factors, 1000% they can, right? And like I've said, I feel like it's getting me down. I've got to be honest with you. This whole thing's getting me down because there's like the desperation for these families here to contact a paper to do an interview because they're shit scared that their loved one in prison is going to die in jail because of the coronavirus. People with weak immune systems, people with underlying health problems. 3 detailed there. 50-year-olds, 51-year-olds, 66-year-old. This is the reality, guys. It's not a laughing matter. It's not a joke. It's highly deadly serious. And another thing as well, right? A lot of these people might have not visited their family for a few weeks, or they might be on a different part of the country, and because of financial restraints that are in place, they might not have seen their loved one for months, and then they might get that knock at the door. You might not have seen your loved one for 12 months because he's been in a prison on the upper side of the country. The knock on the door, your loved one's died of coronavirus. But don't worry, because he's died whilst in our care, we'll pay £3,000 to £4,000 towards the cost of a funeral. People are talking it, but it needs to happen. Look at Iran. I believe Iran released 85,000 prisoners. America, the LA County Jail have stopped. They released prisoners within the county jail, and I'm assuming that's gone across America as well, right? We've seen Italy. We've seen prison riots. Colombia. We've seen prison riots. We've seen dead. We've seen not through rioting. There's been deaths and stuff through rioting in Colombia and in Italy. We're a few weeks behind Italy. We didn't lock down until like a few days ago. Italy had been locked down for about a month. So we have the potential to reach the same level as Italy and Spain with deaths and stuff. And like I said, one thing that I want to stress to you guys as well, I'm quite downbeat tonight. I'm sorry, guys. I'm tired and I'm just exhausted with this thing. It's just, yeah, it astounds me, man. Like, it's just common sense, yeah. The prisons are not going to be able to operate soon, guys. There's more officers that are self-isolating all the time. I believe there's 100 officers off from Belmarsh alone. 100, right? Like I said, it's just... Prisoners are being locked behind the door for 23 hours a day. Some prisoners are being told, right, you can go on exercise or you can have a shower and get on the phone. You can't have both. Other prisons, you get in half an hour for exercise, you're getting 15 minutes for a shower, and you're getting a 10-minute phone call. That's your lot. And then you're locked back up if you haven't already got in-cell telephones. I spoke to a mother today of a prisoner who's in prison for the first time, right? And he's begging the officer for water at the door. He's on his buzzer, screw comes, pops his door. What's up? Can I have some water, please, miss? No, you can't. Miss, the water in the tap is not drinkable. It's scorching hot, right? My cell's red hot and it's the heat's magnified by the glass, right? My cell's like an oven, right? Please, can I have some water? No, you can't. He put his foot in the door. She's walked away. She's gone and got a screw. The big screw's come over. And then he's just said, look, boss, can I get some water? Prisoners are begging for water. These officers now are playing God with prisoners' lives. They really, really are. And like I've said, a basic thing like water, and they rejected the offer. They rejected he just wanted some water. And then, do you know what they did? After 4 hours, they said, yeah. They said, yeah, we'll take it and we'll bring it back in a minute. They took his flask, went and filled it with water, hot water, because in Forest Bank, right, because there's no in-cell kettle, you have to use a hot water like tank on the wing. So the screw's gone, taken the thing, got the hot water, right, put it outside his cell, waited for it to go cold, and then after 4 hours, they've given it to him when it's lukewarm. And the prisoner next door that had seen through the gap, she dropped the lid into a food bin and said, don't drink that water, bro. She dropped the lid into the bin. When they was on exercise, they was given a football to kick around the exercise yard. They're trying to distract prisoners. They're trying to keep prisoners occupied, because the reality is they're extremely understaffed. And if prisoners riot now, it doesn't bear thinking about, because they take the system. Prisoners could coordinate and stuff like that. I potentially see, I see riots anyway. I just, people I'm speaking to, my own experiences, I see riots within our prisons. It's a matter of time. It's not if, it is simply when. The closing of visits and prisons being put on lockdown, I agree with. I want prisons to have more association and stuff like that. But the preventative measures that are being put in place are there to protect prisoners, protect the officers, and protect their families, both prison officers and prisoners and prison officers, right? We've had 2 deaths in 24 hours, guys. One at HMP Lachey, which is 100% sex offenders. An 84-year-old man died there. In strange ways, my old prison, a 66-year-old prisoner died. He had underlying health problems. He was receiving end-of-life care, but he'd already tested positive for the coronavirus. And how it's been labelled in the media is that he died from the coronavirus. It started. And I said on an interview a few days ago, you'll see it down my timeline, and I said, this will go through the prison population like a knife through butter, right? Because like I said, and I've said it 1,000 times, I'm sick of saying it, when you're on the out, your health develops a certain way. When you're in prison, your health deteriorates a lot quicker than it does on the out. And but when you're in prison, it's not just a case of, well, I'll just ring the doctor, I'll walk in and make an appointment. Everything's done through apps and stuff, and they've got fewer staff. They've got fewer staff. And prisoners are going to die from it, guys. Medical negligence. Prisoners have died through medical negligence in the past within our prisons. The coronavirus. The reason you're not seeing more confirmed cases, number one, you can't have confirmed cases if you're not testing all prisoners, number one. And number two, if they are testing positive, the prisoner doing a good job at keeping the stories from getting out. That's why I've got a big mouth. That's why I try and do this. This is why I'm just one guy. I'm a dickhead. Right? I'm not a prison expert. I've not spent the longest time in prison. I've not done a life sentence or anything else. Right? But the thing is, right, I'm trying my best to get people to, if you've got a loved one in prison, if you're watching this, right, I'm speaking directly to you. If you've got a loved one that's in prison and they are telling you there are confirmed cases, or the prison are doing this, or they're not doing this, and they're not helping us, and we're having to beg for hand sanitizer or soap or even water, fucking basic water, right? And they're messing around with the regimes and they're dicking prisoners about and this, that and the other, right? And there's confirmed cases of coronavirus and self-isolating, and there's this much staff off, and this is happening, and there's unrest within the prisons. Please, please, please contact local and national media. Please contact me. I'll do it. I don't really like being on the phone, you hear me? But I will ring up these papers, and I will email people, and I will get it off as much as I can get it off. I'm trying to speak up for prisoners. I'm trying to keeping the prisons in line, in the media spotlight, right? And the coronavirus, right? Hopefully it forces them to act, right? Now, maybe I'm being naive there. Maybe I'm living in a fantasy land where that's not going to happen, right? But please try. Let's try, guys. If your loved one's ringing you and he's telling you that, or she, because we've got female prisoners, and they're telling you, yeah, we've got confirmed cases, or a prisoner has died from this coronavirus, and you don't ring the media or contact someone like me, right? You're actually part of the problem. You're not part of the solution. If you've got a loved one in prison right now, you should be concerned for your own health, safety, and well-being, 1,000%. But if you've got a loved one in prison, you should be petrified. You should be scared shitless. This is no joke. They estimate there's going to be 800 deaths within prison. I see more. Why? Prison healthcare is absolutely piss poor and appalling, right? Prisons are breeding grounds for germs and for viruses and infection, right? Prisons are in overcrowded cells. In Elmley, I believe there's 3 prisoners to a cell. You've got 2 prisoners doubling up in a cell that's meant for 1 man, right? It's just, prisons are not clean places, right? Even new builds like Berwyn, right, are not clean prisons. Dirty. There's only so much the cleaners can do, right? And it's just a breeding ground, guys, for germs and infections and viruses. And with prison healthcare being as bad as it is, and the fact that everything takes time, that delay, guys, is going to cost prisoners their lives. They can't be taking prisoners to prison and be giving them escorts. If you're from a Cat A prison and if you're going from like Strangeways, which is actually a multi-category prison, but it's a maximum security prison, but it houses Cat A, Cat B, Cat C, only actually holds 40 Cat A prisoners and E-list prisoners, right? And you have to go on an escort to hospital from that prison for healthcare reasons, for coronavirus, whatever the case may be. 4 or 5 people in your escort, and if you're a Cat A prisoner, that goes up. They haven't got the staff. So it's easier to leave prisoners in the cells and just say, oh, he had flu-like symptoms, we're self-isolating him. Leave him. He dies. Prisoners are in cells with little or no ventilation. They're locked behind the door for 23 hours a day. Officers are dicking around with their regimes and stuff like that. Food's being delivered to the door. They're shipping prisoners around the prison system, which is potentially spreading the virus. There's not enough being done, guys. They're not even giving prison officers protective equipment, right? So what do you think's happening to prisoners? Some hand sanitizer was put on a wing. It was stolen. They didn't replace it. Prisoners are having to beg for water. When I was in Strangeways, we have to beg for toilet roll. Prisoners are very susceptible at the moment, right? This virus, right? They say, oh, the at-risks, over 70s, young babies with a weak immune system, people that have had radiotherapy, chemotherapy, pregnant women, people with respiratory problems, because obviously this virus affects your lungs and everything, right? Very, very, very dangerous for these prisoners to get it, for these people. And like I said, you can self-quarantine at home and stuff, and you can do all this stuff, right? And you can ring 101, you can go to a hospital or A&E or doctors and all these things if you've got these symptoms, but they tell you to stay away. In prison, you don't have that luxury. Prison healthcare in prison, being as shocking as it is, has cost lives in the past. Now you've got the coronavirus, a highly contagious, highly deadly virus, killing people, and they're powerless to stop it. It's not good, man. It's not good at all. And if you get word that someone's died in prison due to coronavirus, do the right thing, man. If your boy rings you and says, listen, the kid next door's dropped dead from corona, a guy on the opposite wing adjacent to me has died of the coronavirus, do the right thing. Let people know. Any deaths that I see now referenced prison, I'm going to automatically assume coronavirus. Now, there's many different reasons. It could be suicide, it could be a drug overdose, could be medical negligence, could be a heart attack, could be natural causes, right? But my brain's going to go straight to coronavirus. And the older that prisoner is, I'm more inclined to believe that. The facts are 2 deaths in 24 hours, guys. If you think it's going to stop there, you're absolutely clueless. This going to cost hundreds of prisoners' lives. This, if not over 1,000, if not more. Prisons are that bad. And like I said, don't listen to me. I'm nobody. I'm a dickhead. But I'm not doing this for the sake of doing it, for doing videos for the sake of it. I'm doing it because I actually give a shit and I actually care. Anyway, guys, I'm going to knock this one video on the head. I've waffled on for 25 minutes. Stay safe out there, guys. God bless you all. If you've got a loved one in prison, it's just one of them things, isn't it? I'm going to leave it there, guys. Like, comment, subscribe. Cody out.